You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. All right, y'all. As of today, there are at least 11.5 million cases of COVID-19 in the United States. At least 249,000 people have died as a result of the virus. 1,707 new COVID-19 deaths were reported yesterday. That's the highest daily death toll since May. Medical leaders are urging Trump to share data with President-elect Joe Biden. But that hasn't happened yet. In fact, they're not going to do it. That's how callous and despicable they are. Now, Pfizer and Moderna both have vaccines that they say have reached highly effective levels, and Johnson & Johnson expects to have one soon. The Secretary of Health said today he expects a COVID vaccine will be available by the end of December.
By the end of December, we expect to have about 40 million doses of these two vaccines available for distribution, pending FDA authorization, enough to vaccinate about 20 million of our most vulnerable Americans, and production, of course, would continue to ramp up after that. We've paid for the vaccines. We've worked to ensure that administration costs will be covered by private insurers and the federal government through Medicare, Medicaid, and our program to cover COVID-19 costs for the uninsured. So no American will face an out-of-pocket cost for getting a COVID-19 vaccine.
Now, until then, states across the country are doing what they can to crack down on the spread of the virus. Today, New York City, which has the nation's largest public school system, announced it will close schools starting tomorrow. Take a look at what Mayor Bill de Blasio said about that.
No one is happy about this decision. We all, in fact, are feeling very sad about this decision because so much good work has been put into keeping the schools open, opening them up to begin with. Let's start there. Opening the schools when almost no other major school system in America opened, making them so safe. But we set a very clear standard, and we need to stick to that standard. And I want to emphasize to parents, to educators, to staff, to kids, that we intend to come back and come back as quickly as possible.
Things got a little feisty at the news conference with New York Governor Andrew Cuomo when a reporter specifically asked him about those school closings.
A red zone in Brooklyn and Queens, and we closed the schools? Don't you remember that? It was 3 weeks ago. Okay, so what are you talking about? What are you talking about? You're now going to override. We did it already. That's the law. An orange zone and a red zone. Follow the facts.
I'm still confused.
Well, then you're confused.
I'm confused. And
then I'll tell you what, Jimmy.
Parents are still confused as well. The schools in
they're
New York
not
City
confused.
tomorrow.
You're confused.
No, I think
Read
parents
the law.
confused as well.
Read the law, and you won't be confused.
But Governor, following Jimmy's question, are the schools going to be open tomorrow?
The schools are open by state law.
But will they be open tomorrow? That's the question. I think Jimmy's correct in asking that question. I don't think it's obnoxious at all.
Well, I don't really care what you think. Of course, you agree with him because you're in the same business with him. The schools, by state law, well, what is the answer to your question?
Well, joining me now is Dr. Tyson Bale, critical care and infectious disease specialist at the University of Virginia. Dr. Bale, Lord, look, it's frustrating. It's frustrating for so many different people. Parents are going, look, our school's going to be open, they're going to be closed. Like, we have to do distance learning. It's all kind of stuff. But the thing here that I keep looking at, that I keep trying to explain to people as well, is we're talking about folks who are still dying. And we're talking about, I mean, look, I've been reading some of these threads and listening to these nurses and doctors who are quitting the business because they said, I've never seen this much death in a short period of time in my career.
You're exactly right. We have over 1,500 people who died recently from COVID-19 in one day. And at the rate that we're seeing now, with over 150,000 cases per day, we can expect that number to go up to over 3,000 per day. It's an absolutely monumental amount of people that are suffering. And to be honest, I did not think that we would see numbers like this. It reflects the approach that the administration has taken to the vaccine or the COVID-19 virus, coronavirus, that there's going to be hands off and focusing on developing and therapeutics, but ignoring the public health measures that keep people safe in the meantime. So there is good news on the vaccine front, but we're in the midst of a crisis right now that's really exploding out of control.
And that's really, again, the deal here. I saw this tweet earlier where the governor of Alabama, she goes, I'm not shutting everything down. We're not going on lockdown. And you know what? Here's the thing. The reality is we don't have to go on lockdown if people take the appropriate steps. If you wash your hands, have your hand sanitizer, wear your mask, do social distancing, then we can actually have businesses that are open. We can still go about, but you simply cannot. You can't say, I want to do whatever the hell I want to do, but also stay open.
Right. What's interesting is that the people and the leaders that have been resistant to these measures approach it as if it's one or nothing or all or nothing, that you either have to lock the entire economy down or you have to be completely restrictive and no mask wearing, no social distancing or whatsoever. The real strategy to keeping the economy open, to keeping kids in school, which you see is so contentious right now, is to marry these with the public health measures, like you just said. And if we can do that, then we can actually avoid these prescriptive lockdowns that we're seeing. But if cases are going to keep going up like this, we have no choice but to do a strict lockdown. The fight between public health and the economy doesn't have to be in opposition to each other, as long as you understand that, with one, you have the other. And it's really frustrating to see that our leaders are either really falling on one side or the other here.
So we look at these numbers. Now we have the Biden team complaining that the Trump folks are not offering them any support at all and making it much more difficult. We now also have the latest when it comes to these companies with regards to a vaccine. One says 95% effective, very little side effects as well. So again, they're saying, fine, they'll be ready by December. But the bigger problem is then going to be, how do we get folk to actually take it? Speak to that. What do you think has to happen in order for us to say, yes, it's safe, it's real?
I think people in the community that folks trust need to get out in front and advocate for vaccinating our community. I can speak personally for myself and seeing the process and the science that's gone into the vaccine development. I've not personally seen anything that makes me hesitant to take the vaccine. And I do take direct care of COVID-19 patients, and I will be in kind of that first priority for getting the vaccine. Based on what I've seen so far, I have no reservation being first in the line. But the point here is that the administration has lost complete credibility when it comes to communicating information about what people should do around the vaccine, particularly when it comes to the Black community, because we've seen how they've acted around this. But I want to separate that out from the actual approval process, which involves the FDA, the Vaccine and Biological Related Products Advisory Committee, which are made of career scientists and respected authorities that are outside of the government and respected medical schools and healthcare institutions across America. They're the ones who ultimately make the recommendation for an EUA approval or not for the vaccine. So provided they see the data, they think it checks out, it's safe, it's effective, then they make that recommendation, and is outside of the political pressure that the administration is putting on to speed this up. So if we can get that message out and get trusted people in the community to disseminate it, then I think we have a little way of getting penetration the way that we need to in the community.
All right, then. Well, and also, one of the things that we'll be watching out for, the federal government is going to be spending a lot of money on messaging as well. We want to make sure that money goes to Black media and they don't bypass as well. So, Dr. Tyson Bell, we really appreciate it. Thanks a lot.
Thanks for having me, Roland.
All right. On that particular point there, Scott, this is going to be a significant issue when I talk about coronavirus. We got to make sure that our people are indeed being a part of that. We know the games that they're going to play when it comes to freezing us out. And the bottom line is there's going to be a major, millions of dollars spent on messaging when it comes to this vaccine. And then last thing I want to see is, frankly, black media being ignored. But we also have to, this is where also black health experts are going to be so important in communicating to our people about this vaccine.
It's going to be a massive effort. Given our cultural history with vaccines and the tests that have been done on black people historically at Tuskegee and otherwise, it's going to be a massive effort. We are a frontline group that needs it the most, along with the police and healthcare workers, no doubt about it. But we've got two challenges. One, getting it into our community, building trust in that community to take it, and then being able to administer a number of that 40 million doses we're supposed to have at the end of the year, getting it to people so that we can define some type of new normalcy. That's going to take a lot of communication, a lot of marketing, and black leadership in those communities, not only taking it, but showing that it's safe and showing that it's necessary to move our community forward. And so it's a lot of work. Getting the vaccine approved is one thing, distributing is another, and it's vitally important to beating this pathogen.
We simply, look, at the end of the day, no one trusts this administration, Robert. Don't care. They don't trust him. And frankly, thank goodness, as these companies are talking about the vaccine, that we are moving away from these nuts in the White House. Because frankly, if Trump had won again, I don't know who in the hell would have taken that vaccine.
Yeah, I think you're right, because there has been no trust built with the American people. You have to listen to some of the black health experts, people like Dr. Leon McDougall, the National Medical Association, Dr. Deborah Holden, chief epidemiologist at Michigan State University, and other individuals who are part of the community. And we also have to demand from the Biden administration that they put these individuals on that coronavirus task force. It's one thing to simply farm out these things to black institutions and black universities and black healthcare experts. It's another thing to have them at the table. We know for a fact that our communities have been struck hardest by this virus, so we need to make sure that the people who are conducting these tests and these studies, the people who are delivering the messaging, the people writing the policy, the folks distributing these dollars, that if you're going to be investing billions of dollars into virus, not just the vaccine, but also the treatments, the therapeutics, and the development of PPE and so on and so forth, make sure that money's going to HBCUs and to black contractors and black businesses. There's no reason for us to just simply accept this as being an emergency and be happy for the emergency to be over. We need to be put in the exact same position as everyone else if we're going to be expected to take the vaccine. And the best way to do that is have black people and black institutions as part of developing and creating these vaccines and therapeutics.
Folks, back to that Roland Martin Unfiltered video in just one. Folks at Seek.com, founded by Mary Spio, a sister, have these amazing VR headsets. Allows for you to watch their content, the virtual reality content, right here on the headset. You simply pop your phone right into here, close it up, and then you will put yourself in the room watching their VR content on Seek.com, or, of course, content that is on other platforms. And so you can check that out. They also have these are 4D 360-degree headphones right here with tremendous bass that really distributes the sound all across your head. It's great. You can attach a headset to it, so you can actually use it for gaming and playing with free hands. There's Bluetooth as well. So all of these, get one of these items, or you can subscribe to the content at Seek.com by going to Seek.com using this promo code. It's RMVIP2020, RMVIP2020. These, of course, could be some great headphones coming up for birthdays, Christmas, you name it. And so if you want to do that, just go use the promo code right here, RMVIP2020, RMVIP2020, by going to Seek.com. And we certainly appreciate them being a partner here with Roland Martin Unfiltered.